Hi, Sovereign.
Hi.
What's up?
Not much. Just getting ready to do some podcasting.
Oh, I was thinking about doing the same. Do you want to podcast? Like, as long as you're here, do you want to just podcast real quick?
Yeah, we could just do it together.
Oh my God.
Yeah.
I love it. I have the script that you wrote, and I think it's really good. Do you want to just maybe do that one?
Yeah. Let's just rough it. Let's just wing it. Greetings and welcome to Ill Repute, the podcast about women and women first. My name is Syre. I'm a writer, a comedian, and someone that appreciates plastic surgery.
And I'm Ella Darling, a VR pioneer, a former librarian, and a bad bitch, and I just need to keep reminding myself of that. Now, we here at Ill Repute support women's rights.
But more importantly, we support women's wrongs.
And which women's wrongs are we righting today, Sav?
Today, we are taking on our first man.
Oh, we're tag teaming him, are we?
Now, we here at Ill Repute are about women and women first.
Yes.
But sometimes men do important stuff for women, like creating the field of cosmetic surgery. The man we're talking about today is a saint that changed the lives of thousands of wounded soldiers during World War I and pioneered many of the cosmetic procedures that are used today, primarily on women.
Our first honorary woman.
I'm sure that he would get it. I think he would be delighted. So today we are discussing Dr. Harold Gillies.
Take me there.
Is that name familiar to you at all?
Only because I've heard him from you.
Okay. Which is sad because as we get into this story, this person should be far more famous.
Mm-hmm.
So first, let's get a quick and dirty history of plastic surgery. Harold Gillies was not the first plastic surgeon by any means. Plastic surgery dates back thousands of years, with evidence of rudimentary procedures found in ancient civilizations. In ancient India, around 600 BC, Sushruta is often credited as one of the earliest practitioners of surgery and is revered as the author of the Sushruta Samhita, an ancient Sanskrit text that covers various medical treatments and surgical procedures. Sushruta is notably recognized for describing the procedure of rhinoplasty, also known as a nose job. He detailed techniques for reconstructing noses that were amputated as a form of punishment or as a result of injuries.
His texts also mention methods of skin grafting using skin from other parts of the body to repair damaged or lost skin, a technique foundational to modern plastic surgery. Sushruta's approach to rhinoplasty involved a technique called forehead flap, or Indian method. He would harvest skin from the forehead, specifically a flap of skin with its blood supply intact, to reconstruct the nose. The skin flap would be carefully lifted from the forehead, but left partially attached to maintain blood circulation. The flap of skin would then be shaped and molded to resemble the missing or damaged part of the nose. The skin flap would be sutured onto the nasal defect, allowing it to heal and integrate into the surrounding tissue. Sushruta's technique of using a skin flap with an intact blood supply was innovative for the time. It allowed for better healing and reduced risk of tissue necrosis. That's incredible.
Right? That is crazy that long ago they had figured all that out.
Yeah, because they didn't understand the reason, they didn't understand the science or the nuance as to why that was the better choice. They simply knew it worked through trial and error, one must imagine. Oof.
Yeah.
That's really cool.
During the Middle Ages and Renaissance, methods for repairing facial injuries and reconstructing noses were developed by surgeons like Gaspare Tagliacozzi in the 16th century. Tagliacozzi used a technique known as the Italian method for nasal reconstruction. Tagliacozzi's technique involved using skin flaps from the patient's upper arm to reconstruct the nose. He preferred using the skin from the upper arm due to its proximity to the nose and the similarity in skin texture. A skin flap was created on the arm, leaving it attached at one end, preserving its blood supply. The skin flap was then transferred to the nasal defect and shaped to reconstruct the missing or damaged part of the nose. The flap was sutured onto the nose, allowing it to heal and adapt to its new position. So I would imagine in this thing, they would probably have someone have their arm bound close to their face for a period of time.
As so the skin flap kind of transferred.
Yeah.
Ownership.
Distance from places is a thing that Gillies is going to revolutionize. So
fascinating. I know absolutely nothing about plastic surgery. I know the sort of overall stuff, but I don't know any of the inside baseball about plastic surgery or wound healing. The best I can do is I listen to Sob Wounds, which is a podcast about medical history, but it's not exactly giving me anatomy lessons here. So I'm glad that you said that, because I was trying to imagine, if it's still attached to your arm, how do you, are you just perpetually sniffing your own pits, kind of? But yeah, I guess it must have been. You must have had to have your arm bound so that it could be, in close proximity. This is a lot. Okay.
Yes.
Noses were a point of special interest because they were one of the few body parts that could be lost in battle or through injury that a person could survive with the medical knowledge available. When some of Columbus's sailors brought syphilis back to Europe from the New World, it nearly decimated Europe. Those suffering from the pox would often develop saddle nose, a condition where the bridge of the nose breaks down, causing it to sink into the face. People were desperate to hide this condition, as it generally marked someone as being venal, no matter how the injury occurred.
Yeah.
If you got a janky nose, you're probably a hoe.
Exactly. Others went to Tagliacozzi to change their Jewish noses to look less identifiable. It is what it is. Procedures to quote-unquote fix quote-unquote ethnic noses, quote-unquote, are still very common. In the early 19th century, Joseph Caprew performed one of the first modern rhinoplasty surgeries in England, inspired by ancient Indian techniques. Surgeons like Karl Ferdinand von Graeff and Johann Friedrich Diefenbach in Germany pioneered flap surgery techniques in the mid-19th century, laying the groundwork for modern reconstructive procedures. By the late 19th century, surgeons were experimenting with skin grafts, refining techniques for transplanting skin from one part of the body to another. Procedures for repairing cleft lips and palates also evolved during this time, with surgeons like von Graeff contributing to advancements in these techniques.
However, before World War I, plastic surgery was still a relatively niche and evolving field, primarily focused on reconstructive procedures for trauma, congenital anomalies, and the aftermath of disease. The advent of World War I played a significant role in accelerating the development of plastic surgery, as the need to treat soldiers with severe facial injuries led to the refinement and advancement of reconstructive techniques.
Now, of course, war has existed long before World War I. However, in previous wars, a person was more likely to survive losing a limb than a facial injury. Men who had lost limbs in the war were generally viewed as heroes. However, surviving a facial injury was much less likely prior to World War I, because injuries to the nose, hard palate, and jaw usually led to suffocation before help could be administered. Because little was known about how to restore function of these soft tissues and bones, so palliative care would be given until the patient died. That all changed during World War I.
World War I, also known as the Great War, the great one, the final one, lasted from 1914 to 1918 and involved many of the world's major powers. If you don't know, the conflict pitted the Allied powers, which included France, the United Kingdom, Russia, and later the United States, against the Central Powers, mainly Germany, Austria-Hungary, and the Ottoman Empire.
The war saw the widespread use of trench warfare, where soldiers fought from elaborate systems of trenches dug into the ground, leading to prolonged stalemates and immense suffering. It was the first major conflict where modern weaponry and industrialized warfare were utilized extensively. The static nature of trench warfare led to prolonged battles with little territorial gains, resulting in high casualties from continuous frontal assaults and artillery barrages. Modern weaponry, like machine guns and artillery and flamethrowers, caused unprecedented destruction and casualties, far surpassing previous conflicts. The use of chemical agents such as mustard gas and chlorine gas caused horrific injuries, disfigurements, and long-term health issues for soldiers.
While medical care improved during the war, the scale and severity of injuries, especially facial injuries from shrapnel and explosives, overwhelmed the medical infrastructure. Their combination of intense and prolonged battles, along with the devastating impact of new weapons, resulted in a staggering number of fatalities and severe injuries. The improvements in triage care meant that more soldiers who would have suffocated or bled out in previous wars were now surviving. Soldiers faced disfigurements from facial trauma and devastating wounds. From The Facemaker by Lindsey Fitzharris.
Quote, unlike amputees, men whose facial features were disfigured were not necessarily celebrated as heroes. Whereas a missing leg might elicit sympathy and respect, a damaged face often caused feelings of revulsion and disgust. In the newspapers of the time, maxillofacial wounds, injuries to the face and jaw, were portrayed as the worst of the worst, reflecting long-held prejudices against those with facial differences. The Manchester Evening Chronicle wrote that the disfigured soldier, quote, knows that he can turn on to grieving relatives or to wondering, inquisitive strangers only a more or less repulsive mask where there was once a handsome or welcome face, unquote. Indeed, the historian Joanna Bork has shown that, quote, very severe facial disfigurement, unquote, was among the few injuries that the British War Office believed warranted a full pension, along with loss of multiple limbs, total paralysis, and lunacy or shell shock, the mental disorder suffered by traumatized war soldiers, unquote.
Enter Dr. Howard Gillies. Gillies was born in Dunedin, New Zealand, the son of a Member of Parliament, Robert Gillies. He attended Wanganui Collegiate School, and if I said it wrong, I'm so sorry, but he studied medicine at Gonville and Caius College in Cambridge. Once again, I just read, so I don't know how to pronounce. Yeah. In 1910, he acquired a position working as an ENT specialist for Sir Milsom Rees medical practice. ENT is like a ear, nose, and throat doctor.
Ear, nose, and throat, yes.
Yeah. And we've got some really cool photographs here that if you're on our Patreon, you'll be able to look at the script and see some of the cool examples.
Just like a dashing, kind of slender, there's one of him as a kid and then one of him in his like military cap and stuff. Just like a slender...
He's a handsome man with no lips.
Yeah, kind of a weak chin and handsome, but not like overimposing. He's got like long fingers. He's got like a priest's hands, which makes sense because he's a surgeon. So
when World War I broke out, England was on a massive recruiting push. Thousands of underage boys signed up to be part of the war effort. This was before everyone realized how deadly this war was going to be. The innovations in weapons, chemical weapons, flamethrowers, and what would be the bane of the plastic surgeon's existence, white-hot shrapnel, flying in every direction, searing off noses. One story from this recruitment effort is...
Again, this is from the book The Facemaker. Quote, among these recruits were tens of thousands of underage boys gripped by patriotic fervor and a sense of adventure. One of them was 16-year-old Abraham Bevisine, who enlisted under a false name and age. His excitement was quickly dampened when he suffered severe shock after a German mine exploded next to him. Frightened and traumatized, Abe fled his post only to be caught and arrested shortly after. He later became one of 306 British soldiers executed for desertion. Among the deserters was Private James Smith, who fell to the ground, bleeding but alive, after a firing squad's botched attempt to execute him. His friend, Private Richard Blundell, shot him in the head at close range after being promised 10 days leave for completing the execution, unquote.
Jesus Christ.
So when people ask me how I feel about the war, that's what this episode's about. This is what it looks like.
Yeah.
This is what it looks like. Whatever side you're on, this is what it looks like. This is what it does to people. This is how people up. This is what it does to their bodies. This is what it does to their minds. So if you're ever wondering how I feel about an issue like that, this is how I feel.
Yeah.
Yeah. So that's just to give you an idea of like how intense this was. I mean, like it was unprecedented in the destruction.
Tons of civilian women volunteered as nurses. Many of them, who were from the upper classes, had never been inside of a hospital and were completely unprepared for what they would see. From the Facemaker, quote, Enid Bagnold, a British playwright who volunteered at the start of the war, remembered severed legs piled high in baskets outside the door to the operation room. Quote, the wounded came just as they were, their bandages soaked in blood. Operations went on without stopping. Amid this crush, Gillies volunteered for the Red Cross, and soon enough he was called up and sent to France to work on the Western Front. He acted as a medical minder to French-American dentist Valadier, who was not allowed to operate unsupervised, but was attempting to develop jaw repair work.
So Gillies, the first job he got out of medical school was apprenticing an ear, nose, throat specialist because that's who was available.
Okay.
And got really interested in it. Then when he's sent out to the Western Front, this guy is a dentist, so he can't operate. But this dentist has some ideas about how to fix injuries to teeth, jaw, hard palate.
Okay.
So just to set the stage, they were seeing injuries people had never been confronted with before. Someone gets their nose cut off. We've seen severed things before. Someone gets their teeth knocked out. We have seen that before, right? Someone has their face blasted open with a landmine. That is like,
yeah,
there wasn't it's like a routine thing where there was like a standard operating procedure or there was like, this is going to work. I mean, normally people that suffer that kind of a facial injury would suffocate on their own blood before they could get help, right? So it's like, it was a non-starter. So just like these guys are like literally on the bleeding edge of surgery.
The literal bleeding edge.
The literal bleeding edge. And so remember, like triage is get them alive, get them stable. Reconstruction is like at the end of the line, right? So it's like they're trying to do like 50 things at once. But the problem is sometimes things you do to be a life-saving measure can be things that are like really going to fuck up the process at the end. So they were also kind of going through a process of figuring out what was the best thing to have the triage people do to ensure the better result at the end of the line. So
that makes so much sense.
It's chaos. Like it's utter chaos. This book, The Facemaker, is really, really good. And it's intercut with the personal stories of soldiers that were impacted by Gillies' work. I highly, highly recommend it. I read it in a day and was completely radicalized by it. And it's about war, but it's not about war, but you will be radicalized by the time you get done with it when you hear these stories of like what people went through. When Gillies met Valadier, plastic surgery was still in its infancy. Most surgeons had little, if any, experience dealing with massive soft tissue loss and damage. The biggest strides were made during the Civil War after the creation of the conical bullet, which could do a lot more damage. By working side by side with dentists who could reconstruct hard palates, teeth, and jaws, Gordon Buck, a battlefield surgeon, was able to make great strides in reconstructive surgery. But these efforts focused more on the functionality of the face and not the aesthetics. Plastic surgery was still a rarity. There were less than 40 plastic surgeries completed during the entire Civil War.
Gillies was eager after seeing Valadier experimenting with nascent bone graft techniques.
You're gonna learn so much today.
I mean, I know nascent, but not. I thought it was describing I thought something else. Okay. Gillies was eager after seeing Valadier experimenting with nascent bone graft techniques. Bone grafting was first described by a Dutch surgeon in 1668. A Russian surgeon had sought to correct a defect in a soldier's skull by grafting on a piece of bone from a dog. The man later wanted the surgery reversed, and the surgeon found that the soldier's bone had grown over the dog bone. However, a lack of anesthesia and disinfectant made the procedure dangerous. That is, until World War I. From The Facemaker.
Quote, without the use of bone grafts, attempts to close facial wounds often resulted in the severe distortion of the features. which was not only considered unsightly, but could also interfere with the patient's ability to speak or eat. In one case, Valadier replaced 2.5 inches of bone in a man's shattered jaw. In another, he took a section of a patient's rib and inserted it beneath the flesh of his forehead in order to reconstruct the soldier's nose. Once the graft took hold, Valadier reshaped the skin around it. Gillies would replicate and approve upon these types of procedures later in the war. But just think about that. That is amazing.
Getting a bone graft today seems intense. It seems like a lot to contend with. Back then, when they were just kind of shooting from the hip and hoping for the best, and you knew that this is kind of the gamble you had to take because what are your options? That's got to put you in a really treacherous place.
Well, okay, so let me also contextualize this for you because I just did a TikTok about Typhoid Mary.
Okay, so tell me about Typhoid Mary.
Okay, so Typhoid Mary, she took place between 1900 and 1907. That's you can go watch the TikTok if you want to know the story about Typhoid Mary. But basically, public health was something that really didn't get started until the very late 1800s, the early 1900s, with the advent of cities, people being stacked on top of each other. They started to have this concern around like sanitation, health, communicable diseases, etc. Okay.
Mm-hmm.
Germ theory wasn't yet like a big thing, right?
Mm-hmm.
And the big way that typhoid was spread was through people not washing their hands.
Mm-hmm.
So what happened before World War I was everyone got on board with germ theory. And so you had a lot more sanitary surgical conditions.
Mm-hmm.
And 2, anesthetic got better. You could actually put people under and bring them back up, right? So like, because a lot of things that prohibited surgical, like you could do surgery on dead people because they don't feel any pain. So you could practice on the dead, but dead people's tissues don't behave the same way as living tissues do, right? You're not worrying about blood supplies. You're not worrying about arteries. You're not worrying about nerves, right?
Right.
But the other thing that kind of prevented people from being able to experiment much surgically was that the ability to put people under was like fairly limited. And so there was only so much exploring you could do. That had changed. So that is kind of what set Gillies up for success, was like you had these innovations, which was like sanitation and the widespread adaptation of sanitary habits.
Right.
And anesthesia.
Okay.
Like having an actual anesthesiast that could come in and, because for a long time it was chloroform. It was just literally knock the person out and like, that's unpredictable. And, so also pain management, having these treat pain. So a lot of these things had happened kind of in the ramp up to World War I, which is like what allowed what Gillies did to flourish and be successful. So I just wanted to put some context on that.
That is very helpful.
Yeah.
In 2 separate cases involving fractured mandibles, he performed what is now known as distraction osteogenesis, a technique for creating bone without the need for grafting. Although the practice dates back to the 16th century, when Teutonic knights used leg braces and screw mechanisms to straighten limbs, it had never been performed on the face until Private Philip Thorpe was hit by a shell, severing most of his lower lip and a large portion of his jaw. Valadier wired the 2 ends of Thorpe's mandible together and attached an expansion screw to vulcanite rubber plate that was then used to slowly push apart the fractured ends. This helped stimulate new bone growth, which formed to fill the gaps caused by the stretching of the mandible. Oof, that does not sound comfy.
No, it does not. It does not.
When Gillies was on leave in London, he decided to leave for Paris to meet the renowned oral surgeon Hippolyte Moristan. He saw him remove a tumor on a patient's face and cover it with jaw skin taken from the patient. The ward rapidly proved inadequate for the increasingly large number of patients in need of treatment, and upon Gillies' urging, a new hospital devoted to facial repairs was developed at Sidcup. The Queen's Hospital opened in June 1917, and with its convalescent units provided over 1,000 beds. There, Gillies and his colleagues developed many innovative plastic surgery techniques. More than 11,000 operations were performed on over 5,000 men.
That's
Damn.
insane.
That's a lot.
So what happened at this hospital was it became a community.
Mhm.
He championed for, like, we need a separate ward just for these people because what we're doing requires them to go through like multiple surgeries. They're going to be here for months to years before they are better. He also was like, this has to be a multidisciplinary effort, right?
Mhm.
Because we need functionality and aesthetics because he saw how people reacted to these disfigured people.
Mhm.
So he got photographers, sketch artists that would do these like really detailed before and afters to project things and to document the work he was doing because it was fly by the seat of your pants. So
Yeah.
it's like he hired people that were literally just there to document what he was doing because he was doing everything on the fly and seeing what worked. And so he knew that he was going to need records later for future surgeons to be able to follow his guides, but he was learning as he went. He got, for things like sometimes they would have to do prosthetics, so he brought in artists to do that. He brought in dentists so that when they're reconstructing jaws, they make sure that the person can still function. ENT doctors, nurses that specialized in this kind of care, maxillofacial surgeons. Like it's like he created like a dream team.
He had the good sense to recognize that your face has so many interworking components, so many different like muscle groups and just different strategies, different backgrounds, different, like wholly different fields of research, all in a very short space on your body. And he tagged in the people who were the best at doing the very specific things, which is kind of incredible because without the insight of somebody who works directly adjacent, not just to the field, but to the area of the face that you're constructing, you don't really know what you're doing. And that is, it's not just the plastic surgery aspect, it's the health and like wellness of the patients and making sure that the team that they're coming to is giving them a synergistic sort of health service. I don't know.
Yeah. The book describes this community because so these disfigured guys, would be there for months to years. And it was kind of the only place that they could like walk around and not be judged because everyone was kind of disfigured. Everyone was like, whatever. And they also knew that once they sent them out into the real world, they were going to encounter reality, right? The reality of their situation. And they were really emotionally invested in getting these guys like the best results possible.
Right.
And like that is like what really came through in the book is that all of these people were really devoted to trying to improve the lives of these people who had been, because a lot of them had stories of just being abandoned and shunned and whatnot. He was literally writing the plastic surgery manual as he went.
Right.
Because it was like you were looking at pictures of them before, and then how are you going to get it to the after? And he also made a lot of discoveries. So among the strides that he made was something called a tubed pedicle, also known as a pedicle flap or simply a pedicle. It involves transferring a flap of tissue, skin, or muscle from one part of the body to another while keeping its blood supply intact. This method ensures that the tissue remains nourished by its original blood vessels until new blood vessels form at the recipient site. So the tissue or skin flap is typically taken from a donor site on the patient's body. During the procedure, the flap is not completely detached from the donor site. It remains connected through a segment of tissue known as a pedicle. This pedicle contains the blood vessels supplying the flap. The flap, still attached through the pedicle, is carefully transferred to the recipient site, needing reconstruction or repair. The technique allows for the transfer of tissue with its blood supply intact, promoting better healing, reduced risk of tissue loss, and improved functional and aesthetic outcomes. Keeping the blood vessels intact ensures that the transferred tissue remains viable during the healing process. The preserved blood supply lowers the risk of tissue death at the recipient site, enhancing the success of the reconstruction. And so here you see, I've included some progress photos from like what he got to where he got them. So it's two different patients.
That's incredible.
Yeah.
That's incredible that they not only survived, but they survived looking as close to what one must assume was their original look based on, like, these are very graphic photos.
Yeah.
And if you're sensitive to seeing anything like this, like, be cautious when you're looking. But the progress and the impact on just how this must have allowed them to conduct their lives is incredible. He also was responsible for or discovered the tubed pedicle graft technique. A tubed pedicle involves creating a tube-like structure from a section of skin and subcutaneous tissue, which is then used to transfer the tissue to another area of the body. This method is often employed when the recipient site requires a significant amount of skin and soft tissue for coverage, such as in the case of extensive wounds, burns, or after tumor removal.
So the graft has to stay connected.
Mm-hmm.
And he was like, the bigger the distance, the more tissue, the more likely of infection and necrosis, right?
Yes.
So he was like, what if we take the graft, right?
Mm-hmm.
And we roll it up like a straw around the tissue we want.
Okay.
And so then it's like, and then we attach it. So now we have like a protective coating around the tissue that we're going to take.
Yeah.
So he's like, what if we make like a skin straw and then we pull the tissue we want through that?
Okay.
And so then when it attaches and we're ready to use it, we cut open that skin straw, right? Toss that away. We don't need that no more. And now we have this juicy, fresh, plump and pink and wet tissue that we can put over the wound.
Okay.
And so there's pictures here and people can see, like, you see someone with a tubed pedicle. You see in image 3, those tubes coming from the back of those are protective tubes. The tissue they're going to use is inside those tubes. You see it in image 4.
Mm-hmm.
So it's just a way of like, he's like, how can I protect these flaps so that more of them take?
Yes.
Right.
Okay. That makes so much sense.
How do
That's
I
brilliant.
protect them? Like, why don't I wrap skin around them? And then
That's amazing.
And then we can take more tissue because we don't have to worry about it necrotizing or becoming infected.
And then once it's established there and it has stable blood supply, the connection to the original site can be divided surgically, and then that tissue can be reshaped and adjusted for whatever the reconstructive purpose or result.
And the straw can be like reattached to the donor site.
Oh, no. So you can actually just put that straw.
Like a 2-for-1.
That's really cool.
So obviously, this is something that takes time. This is something that takes multiple surgeries. You have the surgery where they create the flap.
Mm-hmm.
Then you have the surgery where they attach the flap. Then you have to wait for that to graft. Then that surgery that then shapes the graft. Then you have to regraft the donor site. Then you have to wait for that to heal. And then you can shape it more. So these are this takes months, right? And so in between these soldiers have nothing to do but sit around. So like they were all kind of like, so you have to imagine this hospital became this really interesting place where you've got these people that they're in various stages of plastic surgery, like waiting for grafts and things to take and just hanging out with each other and the nurses and like forming this really intense community with each other as they're kind of also psychologically preparing themselves to re-enter the world.
Wow.
So he pioneered that. So Gillies applied the tubed pedicle technique extensively in facial reconstruction, allowing for the transfer of tissue with its blood supply intact to repair extensive facial injuries sustained by soldiers during World War I. His approach significantly improved outcomes for soldiers with severe facial trauma. He developed jaw reconstruction techniques. So Gillies pioneered techniques for jaw reconstruction, including bone grafts and bone transplants to address extensive injuries and deformities of the jaw. His procedures not only aimed at aesthetic restoration, but also focused on restoring speech, chewing, and overall facial function. Development of specialized instruments. Gillies designed and adapted specialized surgical instruments and tools to facilitate intricate facial surgeries, aiding in precision and effectiveness during procedures. Some of the instruments associated with Gillies include
Gillies forceps. Gillies designed specialized forceps adapted for delicate and precise handling of tissues during surgeries, especially facial procedures. These forceps were tailored to grasp and manipulate tissues gently to minimize trauma and facilitate precise surgical maneuvers. And then Gillies needle holders, which he developed with a specific design to securely hold fine needles used in delicate tissue suturing, ensuring accuracy and control during stitching. These needle holders were instrumental in enabling surgeons to perform fine and meticulous suturing in reconstructive surgeries. Gillies scissors. Gillies designed scissors optimized for facial surgery, featuring delicate, fine-tipped blades for precise tissue cutting and trimming. The design allowed for enhanced control and maneuverability in delicate facial tissues. So essentially, any tool that you need for this purpose is going to be very, very small, very fine, very precise, and you need something that will help you have control over it because it's so small.
Yeah.
And it's so easy to cut.
I had upper eyelid surgery because I had droopy eyelids. And when they cut open, they do an internal stitch first on this very delicate membrane. And then they do the stitch over your actual outer eyelid. So when you see someone that's had eyelid surgery and you see the stitches on the outside, that's not really doing.
Okay.
What's doing is there's dissolvable stitches on the inside of the skin that are actually holding everything together.
Okay.
And going in to get those taken out was so painful because of how tight and small they were. And the kind of scissors, it was very I was reading this and I was like, thank you, Dr. Gillies, thank you for the Gillies scissors because they have to get in there and take out stitches that are you need a magnifying glass to see them.
I will likely get that same surgery in the next few years, and I'm just gonna pretend. It's like magic.
My eyes were so hooded that I was getting migraine headaches and I was starting to have blepharal twitches and stuff. It was, my insurance would have covered it.
It runs in my family. Sassy's my dog's, my grandmother, who is the former, Sassy's mom. She had to have the same surgery. I remember her going through it about 10, 15 years ago. And so it's just something that I've always, ever since then, I was like, oh, okay, so that's that runs in my genes. I will be looking forward to that one day.
My grandfather had to have it twice.
Really?
And and then my mom had to have it. It's when I say that genetically our eyelids are heavy, I'm not around. They're you can barely see. She could hardly see by the time she had to have it done and insurance paid for it. It was considered a medical necessity. Okay. So 5,000 people, life-changing, creates a whole new field of surgery. We can say plastic surgery existed and technically plastic surgeries had been performed, but the idea of reconstructive cosmetic plastic surgery as a distinct field did not exist. There was no such thing as a plastic surgery specialty. There was no such thing as going to the plastic surgeon. That did not exist. There were plastic surgery operations, but there was not a specialty. You couldn't go to a surgeon and ask them to do these things for you. This was it did not exist as a field.
And even when you could get it, there's no holistic approach. They're focusing on one procedure, not the outcome, not lifelong comfort, not aesthetics and social perception. And that's a lot to consider. And that has such a huge impact on quality of life.
Yeah. And he was really impacted by that. When he saw the ways in which people's lives were changed by having these procedures and saw how much physical appearances really matter, it radicalized him in terms of, we'll see, in terms of things. But so he literally wrote the book on plastic surgery. You couldn't specialize in plastic surgery because they didn't have plastic surgery books. They didn't have a curriculum. They didn't have someone to teach it. They didn't have a standard. They didn't have anything, right? So it's even if you had wanted to be I want to be reconstructive surgery, and they're there's no book on that. I don't know what you, there's no society, there's no association, there's no board. There's no certifications for it. Okay.
Mm-hmm.
So he's literally writing the book. He had that person in there that was doing all the sketches, taking all the photos, documenting like everything they were doing. He was literally writing the book on how to do plastic surgery.
Right.
So the war was from 1914 to 1918. For his war services, Gillies was knighted in the 1930 birthday honors. Sir William Arbuthnot Lane, 1st Baronet, commented, quote, "Better late than never." So between the wars, Gillies developed a substantial private practice with Rainsford Mallam, including many famous patients, and traveled extensively, lecturing, teaching, and promoting the most advanced techniques worldwide. But this was viewed with a considerable amount of side-eye.
Cosmetic surgery was looked upon negatively for several reasons. There was a prevailing belief that altering one's appearance for non-medical reasons was morally questionable. Cosmetic surgery was often associated with vanity and superficiality, which were considered undesirable traits, which it still is today. And just like today, it was never anybody else's business.
Yeah. Cosmetic surgery lacked standardized training programs and certification processes. As a result, many practitioners entered the field without formal qualifications or specialized education, leading to concerns about the quality and safety of their procedures. Some surgeons viewed cosmetic surgery as ethically questionable, particularly when it involved elective procedures aimed solely at enhancing appearance rather than addressing medical issues. This perception contributed to a sense of moral superiority among surgeons practicing in other specialties.
Which, again, still happens.
Yeah.
We talk about cosmetic procedures, and we have to pathologize our decision to do these things. I frequently find myself explaining that actually when I get Botox, it really does help with my migraines, which it does. But I don't get Botox for my migraines. I get Botox because I like to be hot, and it makes me feel hot, and it makes me feel good. I still find myself, even knowing that I don't need to explain myself to anyone, I still find myself defaulting to that.
I also, as a creator and as an artist, I'm like, this guy's working with his hands tied behind his back, blindfolded with house music blasting in his ears 24/7, right? Like, that's how he's operating. And he is killing it. I have to imagine for his own ego, there was some part of him that was like, what if I start, right?
Mm-hmm.
With a patient that is not in trauma? What if like Ella Darling comes in and I see Ella Darling's face and I go, okay, I'm used to
my work here is already done. Walk out the door, young lady.
Like, but you know what I mean? Like he can be like, I'm used to operating on someone with their face blasted open. Right. Mm-hmm. So I've learned all of this stuff. And like, she comes into me and she says she wants to have a pointier chin or she wants to have eyelid surgery, right?
Mm-hmm.
There's got to be a part of my ego that's going, I wonder how good I could make her look using all the stuff I learned in the trenches. But now I'm working with a healthy patient that doesn't require massive reconstruction, but like, I wonder what I could do. I wonder how much I could improve her looks. I wonder how good of a result I could get her. Right.
Yeah,
and so I'm sure there's a part of his ego that was just like, yeah, like I want to see what would happen if I did this on people that had normal faces. And then like they're wanting this or that done. Cause like, you know, I know how to do rocket science and someone wants me to make them a paper plane. I'm going to nail that. You know what I mean? Like, I feel like there might've been a part of his ego that was just like, yeah, I want to see what this would look like if I started with a patient that was completely normal. Right.
It's interesting that you call that ego, but I would call it intellectual curiosity. Like I have had to, like I figured out all this. What if I took away all the hard, like what if I just am running on like my bonus X small cards? I've been playing a video game that has everything. It's like Tetris in my brain. But like, what if I can take everything that I've learned in the worst case scenario, take away the worst case, and then all of the big moves that I've been making starting from negatives, if I'm starting at 0 or 5, I bet I could hit 10. I'm not just trying to aim for average life. I'm trying to, and I, from an intellectually curious place, I could see why that would be really rewarding in and of itself. Just like I worked so hard to do this. let's just have fun for a sec.
Yeah.
Like, you're not about to die. You're not about to be rejected from society because of the grievous wounds that you've sustained while chasing what you thought was a moral effort. Let's go there.
Yeah.
There may have been professional jealousy or competition between cosmetic surgeons and other surgeons. As cosmetic surgery gained popularity and profitability, some surgeons may have viewed it as encroaching on their own practice areas or diminishing the prestige of traditional surgical specialties.
As surgical techniques improved and became safer, the outcomes of cosmetic procedures became more predictable and reliable. This increased the credibility of cosmetic surgery as a medical specialty. The establishment of standardized training programs, certification processes, and professional organizations helped to professionalize cosmetic surgery. These initiatives ensured that practitioners had the necessary skills and qualifications to perform procedures safely and effectively, thereby enhancing the reputation of the field. And a lot of that is going to be thanks to Harold Gillies, because he was so celebrated and he was staunch in his defense of his job. And he said frequently, if I can make someone feel better and make their life easier, I'm going to do it. If the woman comes in and has a huge nose and says it's ruining her romantic prospects and she is teased and bullied, if I can make her experience better, I'm not here to judge why she wants to do it. I'm not here to give her platitudes. I'm not here to give her platitudes, because I understand the reality of it, that's her reality. And she would like to change it. And I would like to empower her to change that.
I love that he was also pioneering patient agency.
Yes.
And refusing to infantilize his clients. Like, whatever it is that you're experiencing, I believe you. I believe that this is impacting your life. And I'm not going to sit here and try to, I think a lot, especially at the time, based on the way that some of the other surgeons of his ilk were responding to him, it seems like there was a little bit of a chip on certain shoulders about the work that they did. And I love that he just came to it like, look, you tell me that this is impacting your life. I believe you, because it's not up to me to decide that for you. And just in terms of patient care and respect and dignity, that's huge.
Yeah.
Like, all other procedures aside, that's a pretty big deal to me.
Yeah.
Over time, societal attitudes towards beauty, aging, and personal appearance evolved. There was a growing acceptance of cosmetic procedures as a means of enhancing one's self-esteem and quality of life, rather than merely indulging in vanity. This cultural shift helped to destigmatize cosmetic surgery and fostered greater acceptance of it as a legitimate medical practice.
And then we get to the capitalism of it all.
Yeah.
Increasing patient demand for cosmetic procedures drove the growth of the field and forced the medical community to recognize it as a legitimate specialty. As more individuals sought out cosmetic surgery for a variety of reasons, including correcting congenital deformities, reconstructive surgery after accidents, and enhancing physical appearance, it became increasingly difficult to dismiss cosmetic surgery as merely a frivolous pursuit.
In 1930, Gillies invited his cousin, Archibald McIndoe, to join the practice, and also suggested he apply for a post at St. Bartholomew's Hospital. This was the point at which McIndoe became committed to plastic surgery, in which he too became preeminent. During World War II, Gillies acted as a consultant to the Ministry of Health, the RAF. He organized plastic surgery units in various parts of Britain and inspired colleagues to do the same, including pioneering plastic surgeon Stuart Harrison, who founded the plastic surgery unit at Wexham Park Hospital, Berkshire. His own work continued at Rooksdown House, part of the Park Pruitt Hospital, Basingstoke. I probably mispronounced that. I'm sorry, England. During this period and after the war, he trained many doctors from Commonwealth nations in plastic surgery.
So, this is my favorite part. And this goes into why he was a badass. Instead of retiring at the end of the Second World War, Gillies had to keep working as he had insufficient savings. He wasn't a big spender. He liked to golf and he was kind of rock and roll, but he was often working at a deficit. He could have been a millionaire, right? But he wasn't. Like he was first and foremost a member of his community, a servant.
Compassion is the killer of bank accounts.
So in 1946, he and a colleague carried out the first sex reassignment surgery from female to male on Michael Dillon. Don't worry, we're going to get into that in its own episode.
Next week.
Yeah.
Ish.
So in 1951, he and colleagues carried out one of the first sex reassignment surgeries from male to female on Roberta Cowell using a flap technique, which became the standard for 40 years, which would be the 1990s.
Damn.
So let's talk about this.
That's incredible. So I knew about Michael Dillon. I knew that he was responsible for the first phalloplasty for a trans man. I didn't realize he also performed sex reassignment surgery, like bottom surgery for a trans woman as well.
Coming back to his statement, I want to help people feel comfortable in their bodies.
Phenomenal.
Now, why? Why did he know how to do a phalloplasty? Let's talk about it. Trench warfare. 2 major injuries, face and groin. Because you're in a trench and you put your head up to look out. And then, boom, you get blasted in the face. Or you're walking and you step on a landmine and it blows your off. So while he was reconstructing faces, he was very experienced in reconstructing male genitals.
Really?
Because he had to do it a lot. Yeah.
Okay, so that's fascinating. And while all the facial surgery and all of the technique and all of that is really, really interesting, I feel like the phalloplasty that he was doing, I don't know if it's actually called phalloplasty.
Yeah, it's called a phalloplasty.
Even if you're just reconstructing existing penis, not building a new. The fact that he was doing that is, to me, almost more impressive than the face. Even though the face has got so much work going on, it's what people see, and it's a lot. It's a lot. But being able to do that to somebody's penis, that is, oh God, it's the 2 moneymakers.
Yeah, like, so I think the reason there just isn't more documentation on all of it is just because of prevailing things around propriety and modesty.
That makes sense.
So, people weren't going to be talking about his penis reconstruction surgeries, and he wasn't necessarily going to be talking about them. But when Michael came to him and told him his story, Gillies just looked at him and said, "Yeah, I think you're a very good candidate. This seems like a necessary procedure," and wrote him a doctor's note.
Goosebumps.
Yeah.
Gillies suffered a slight cerebral thrombosis at the age of 78 while undertaking a major operation on the damaged leg of an 18-year-old girl on August 3rd, 1960. Gillies died on September 10th, 1960 at the London Clinic in Marylebone. Despite earning an estimated £30,000 per year between the First and Second World Wars, he left an estate of only 21,000-ish pounds. Well lived and well spent.
I think so. I'm good at this. I'm going to guess that 30,000 pounds per year in 1960. I'm going to guess like 80,000 to 100,000 in today. 30,000 pounds per year. I'm going to guess like 120,000. Oh, between the First and Second World Wars. So let's say 1940.
All right, let's go 1940. Calculate. Okay, $30,000 in average in 1940 equals in April of 2024. $671,000. Let's just round up to 672.
Our economy is.
Yeah, we are so ruined. Oh man, we're in the gutter.
Our economy is so.
Yeah, everything sucks.
All right,
but that's huge. That's huge.
Yeah, he's a good dude. I guarantee you, he gave most of that back to patients or like spent his own money to do.
I am sure that he did a lot of things out of pocket, because when you are invested in something like that and you see a case in front of you that is dire, you're not going to be like, oh, darn, Your credit card didn't actually work. So toodles.
Exactly.
When you're in that role, it's because you're dedicated to your field, not anything else. And thank God for Harold Gillies. Honorary illreputation.
Honorary lady. Sources for today was one. Well, it was my own brain in terms of history stuff. But sources for today was primarily an amazing book called The Facemaker by Lindsey Fitzharris. It's incredible. And it will absolutely radicalize you against war. It will radicalize you. It's a book without an agenda. It's telling the story of the life of a dude, but it's unflinching descriptions of what happens to people in war, and specifically what happens to their bodies is radicalizing. It's just,
amazing. Thank you. Thank you, Dr. Gillies. Thank you for your contributions.
Thanks.
Thank you for
Harold.
what you've done. You're a bro. You know what? Me and all my homies love Dr. Gillies.
Yeah. Thank you, sir. Yeah.
All right. And you have been Sovereign Syre, and I have been Ella Darling. And our Josh Anderson is our producer, our editor, and our wrangler sometimes.
Yes. Our creative director.
We love him so much. We are so grateful. So grateful we are for him.
Yes.
Thanks, Josh.
We have a Patreon, patreon.com/illrepute. Treat it like a tip jar. We have one tier. It's $5 a month. If you would like to basically leave a tip, it takes a lot of research and work to make this happen. If you would like to throw us a $5 each month to buy us a cup of coffee, we sure enough appreciate it. If you can't afford to do that at this time, we also totally get that. And if you could just rate us 5 stars and drop a nice review on Apple Podcasts, if you could just, send the podcast to your friends and be like, hey, check this out. If you just want to mention us on social media, like all of that really helps us grow. And that, all we want now is to just get more information to more people. So, anything you can do to help us grow our little podcast is very much appreciated.
And if you hear that and you're like, I would, but what's it gonna matter? Like, who the fuck am I? Just little old me. Little old you is everything. It's everything to us.
Yeah.
Your words, your support. When you go on Reddit and you're like, oh, you like podcasts like that? Listen to Ill Repute. I see it, and I sometimes literally cry because I'm so touched and moved that people are listening to us and feel so good about what we're doing, what we say, and please don't ever stop.
Yeah.
And if you're inclined, thanks.
Yeah. And we'll see you guys next week where we're going to be talking about Michael Dillon.
Michael Dillon, I am already such a big fangirl.
Is daddy.
Yes.
Like, trust me.
Daddy.
Like, Michael Dillon
daddy.
is daddy. Like, great story. Yeah. Great story. Great looking dude. Great looking guy.
Very, very.
Yeah. All right,
Sovereign,
we did it.
Thank you. Thank you for your hard work this week and making the script and being amazing and have them titties right there. Lodi.
All right.
Love you.
Love you.
Let's stop recording.
Yes.